All right, so this is part 5 of Body Mechanics for Massage Application, and we're going to focus on pressure delivery. And we're going to focus on pressure delivery with forearm first. So we want to make sure that you understand what forearm first means and what we mean when we say the forearm. So a lot of times people say they're going to use their elbow. I recommend you do not use your elbow. First of all, it's very hard and bony, and it's more potential to cause discomfort to the client. The other one I see is where they use this part of their arm, and your ulnar nerve is right there, and you can cause compression issues to your own ulnar nerve. So we're talking about from the tip of the elbow to the first third down through here. That's where that's going to be. And a broader base contact is going to give you good pressure depth without causing tissue damage. And then we will show you how to increase the perception of pressure just by narrowing that contact area just a little bit. I want to show you the stance, and then I'm going to actually move around to the other side of the table so that you can see what the pressure delivery is doing. So we get ourselves lined up like we talked about in previous videos. And I'm going to make contact with my client. And we want to make sure that we're not having part of our arm hang over here, because it comes down like that. And what's the point with that, Luke?
So what we're seeing is that she is using ground reaction forces and closed kinematic chains. That's some fancy terminology for everyone, but that's why her back heel is down. And that allows those stacked joints and bones to leverage her body weight into the opposing arm. And she has to get her forearm set where the pressure is going down the bone of the upper arm, the humerus. She has a stable scapula, shoulder blade, to stabilize the shoulder joint itself, but that weight needs to go through the humerus, and thus we need to be starting our pressure at the elbow, and then it is dispersed into the rest of the forearm. But we can't be just working at mid-forearm. The elbow is just going to bend and our whole body twists, and we lose all that, all our body weight and mechanical advantage.
The other thing that people will do is they'll have their feet positioned so that the pressure-bearing leg is opposite. So they get this.
Is the same.
This, yes.
She has a little dyslexia, everybody.
Yes, I do.
So, but she's saying what people this is common for more like a martial arts kind of mindset. But remember, that's fast points of contact, not long distributed pressure. So here she's showing where the straight leg, the reactive leg that's actually creating the pressure with her pushing into the floor with her heel, she has that as her right leg, and she's trying to use her right arm. That is not going to offer the same mechanical advantage.
No, it doesn't. And part of that is because now I have got my weight balanced between my 2 feet. Mm-hmm. And what I want is weight to transfer forward. So it's based between my foot and my contact.
And the weight, all objects will balance as it's going to translate from one side to the other. So if she has a stable right leg, she's going to then have a more stable left arm.
So I'm going to ask my client to please move closer to the edge of the table. I am going to get myself set up so I can lean up a hill. And what we hope that you're going to see is as I apply more pressure, that the space between the tape, so this is our skin, superficial fascia, first layer of muscle, deep fascial compartment, second layer of muscle fascial compartment, and then even further down here to the structures that are closest to the bone.
And I'm actually going to pause, and then we're going to zoom in a little bit here.
Okay, so I'm going to lay here, and you're going to talk about what tissues I'm in.
Exactly.
Here,
so she's now made contact with the skin. And we as massage therapists, I feel, tend to think either too superficial or too deep. We need to consider all layers of tissue. So this initial contact, we're interacting with the sensory nerves of the skin and potentially even causing some distortion of the superficial fascia. So that yellow tape. Then the key thing I want everybody to pay attention to here is how much space, we're losing some contact with this green tape. Not only do we create a bend of the whole compartment, and this would be, let's say there's a bone here, but this would be all the tissue of, let's say, the anterior, posterior leg. But as she applies more pressure, what happens to these chunks in between? This would represent the actual muscle tissue. And in order to change its tone, we really want to be able to have a sustained distortion of that tissue. So, as she applies.
Ready?
Yep.
Now, all of this force is coming from my back leg, okay? And all I'm doing is applying gradually more and more force into my foot. So what do we got here, Luke?
Now we're really seeing a good distortion. Initially, unusually enough, we started to see how the blue and the green tape came closer together. But as we can show here, using this forearm with good biomechanics, we're creating a really good effect and distortion on both layers of muscle. The first layer of muscle and the second. And then coming back out of that.
And even into the third.
Yes.
Down through here.
Let me pause and get that tape a bit better set so we can represent that. So let's pay attention to that again. Watch the yellow to the blue tape. There we go. Now that first layer of muscle is starting to really distort. We're creating a compression force into that, and sustained compression is where we're going to get most of our tonal changes. Now you can really see that blue to the green. Now we have a pretty even distortion of all tissue.
And that's going to feel like good pressure.
That's going to feel like very good pressure. But can you tell that she's able to hold that? She's able to hold that for a long period of time, and her pressure is distributed over a much broader base than if it was just a sharp elbow. This is going to be more comfortable for the client, more comfortable to her as the massage therapist, and it's actually affecting more tissue.
Now, if the person says they want more pressure, usually what they want is a increased perception of pressure. And how you do that is you change the distribution of the contact area. So here's what I'm going to do with that. I'm just going to create a little bit of a sharper edge by just bringing my arm up just a little bit.
Mm-hmm. That's still distributed from the elbow to about the quarter or a third portion of her forearm. It's never just the sharp edge of the elbow. Not sharp edges, broader bases. Beautiful.
And then out we come. Now, let's talk about points.
Using a sharp edge. Like
so
this would be like the tip of the elbow or a thumb.
Okay. Notice when I do this that I get all kinds of activity here, but not as much distributed over the whole body.
Might need to bring that just a touch closer. So.
Oh, right here?
See, you're pushing right there.
Okay.
Yeah.
So it seems like there's more happening, but there's more happening right in a localized area.
Mm-hmm.
And to do that, have to get up on top. My weight is on my front foot now, and that wants to drive my shoulder up.
In order to effectively get the elbow point, you have to internally rotate the shoulder a deduct too much, it really does twist you.
And people want to use a thumb, even a braced thumb, all right? What I'm really doing is I'm not penetrating down through
No,
there.
you can see there's no distortion of the blue to the green.
If I use a tool, or this is a little bit easier to see on what happens with some sort of point application. See, again,
Same thing. That really demonstrates it better. The person feels intensity. They feel like you're digging on a spot. Yes, but is it truly affecting the tissue in the most effective way?
And this is a lot of force in a narrow area. This is a potential for a bruise here, as opposed to...
And immediately, even with just moderate pressure, we see a distortion of the entire compartment of tissue. So this is what gets missed. Clients and therapists the clients are asking for a level of intensity. They're looking for something that feels like it's accomplishing, a therapeutic outcome. But, and the therapist is looking for a mechanical way to create that intensity. We, by using good biomechanics and our forearms, are going to be able to much more effectively create that.
And a couple of little tricks on that are, I can sharpen the edge just a little bit, and I can say to the client, push back into me just a little bit.
And that is an easy aspect, and we'll bring that component more into play, where if we ask the client to actively move, they can sometimes even help guide us into where the desired level of pressure, or even the small adjustment of being the quote-unquote on the spot. That can be a great assessment tool of the therapist applying pressure and then the client helping find the right amount of pressure. It can, tell you maybe a movement. It can give you lots of good information, and it gives them a level of control. If it's too much, they can move out of it.
That's right.
And if it's too little, they can move into it.
Now, I want to reinforce, I'm at a high table.
Yep.
It's about at hip height. This is about an average client height. If I were to use the palm of my hand, it's narrow again, and I have a tendency to want to use my upper body to do that. So forearm first.
Forearm first.